Good evening and welcome to Over the Counter, a half-hour show that focuses on health. My name is Monique Hammond, I'm a pharmacist, and tonight we shall be discussing medications that are used in treating type 2 diabetes mellitus. And we shall be talking, of course, about the medicines. We also shall be looking at precautions, at side effects, and also at the use of over-the-counter medications by diabetic patients. And our medicinal herb for tonight will be the little purple coneflower, or as we know it in Latin as Echinacea purpurea. Now, type 2 diabetes is also called non-insulin dependent diabetes, or you might be recalling the older name that we used to have, namely adult onset diabetes. So, if there is such a thing as type 2 diabetes, then is there also such a thing as type 1 diabetes? And yes, there is. It is called insulin-dependent diabetes, or you might recall the older term again, juvenile onset diabetes. Now, in type 1 diabetes, the body, for some reason, all of a sudden stops making insulin. The only way that these people can be treated is by furnishing the insulin to the body from the outside, usually through shots or injections. Now, insulin is a hormone that is made by a gland called the pancreas. And I'm showing here a picture of your average pancreas, and then the inside, of course, is like a close-up of what the inside of the pancreas might be looking like under the microscope, because it is in the inside that we are finding those cells that are producing the hormone called insulin. Insulin allows the body to utilize the sugar or glucose that we have in our bloodstream for energy and growth. And if we do not have any insulin, then we would be dying pretty fast. As a matter of fact, we would be probably starving in the middle of plenty, as we say. Because no matter how much we eat, no matter how much glucose we have in our bloodstream, the body cannot utilize it, it cannot get into the cells without the help of insulin. Now, about 14 million people in the United States are affected by diabetes. And of those 14 million, roughly about 90 to 95% have diabetes type 2. And of those people who are treated for diabetes type 2, about 35% of them are treated with what we call oral hypoglycemics. Or in other words, they are treated with medications that help them to control their blood sugar. Now, most people with diabetes type 2, at least in the beginning, are successfully controlled by diet and exercise programs. Also, if we talk about these medications, we have to point out that they can only be used in type 2 diabetes. And they are contraindicated in pregnancy no matter what type diabetes the mother has. Diabetes in pregnancy is always treated with insulin if need comes up. These medications also are never a replacement for the diet and exercise programs that we might be on. Because many patients get the feeling that, oh, now I'm on these pills, and now I can sit back and relax for a while because they will be taking care of all of my problems. Well, it's not so. Because usually these medications are started after a patient fails to respond in a satisfactory manner by diet and exercise alone. The medicines are merely another tool that can help us to control blood sugars. The medications that are currently used are all in the family of the sulfonylureas. And this might be a big word to pronounce, but actually it's not any worse than saying polyester, acrylic, or polychlorinated biphenyls. We are reading these things every day in the paper and we have no problems with it. Nowadays we have two generations of sulfonylureas that are used to treat type 2 diabetes. The older medications that appeared in the 1960s, of course, make up the first generation. And the newer products that came out in the 1980s account for the second generation. And now we are also studying another compound in the sulfonylurea family, and it has a pretty good chance of becoming the first member of the third generation. The medications in the second generation are a lot more potent than those in the first generation. Some 100 to 150 times more potent. The major difference lies in the chemical structure, of course, and then also in the way of how they bind to the proteins in the body. The exact way of how these medications are working is still somewhat unclear, but there are certain things that we do know. And here are some of the facts. First of all, they stimulate the pancreas so that it releases a little bit more insulin. They normalize the production of the glucose by the liver, and they also help to make the insulin that we do produce more effective. And this is, of course, a very simplified version of how these medicines work for us. But now let me introduce you to the 4 members of the first generation. First, we have tolbutamide or Orinase. Tolbutamide is the generic name and Orinase is the trade name. This is the shortest acting and the least potent of the group, and it is oftentimes considered as being a good agent for elderly people. Then we have tolazamide or Tolinase. This medication is absorbed less fast than the others, and it sometimes takes up to 4 or 5 hours before it even starts to take effect. Then we have chlorpropamide or Diabanese, and this is the longest acting agent of the first generation. And it is also the one with which we have sometimes the most side effects. Then we have acetohexamide or Dimalor, and it's not used very often. The dose needs to be adjusted in people who have kidney disorders. And now for the second generation. There are 2. The first one is glyburide, also known as diabeta micronase, or a new name glinase, which is a new formulation. And then we have glipizide or glucotrol. Now both agents in the second generation, the glyburide and the glipizide, and I'm kind of going to stay with generic names here, are taken in the morning before breakfast. They are usually taken once a day. Sometimes your doctor might say to take them twice a day, and that's usually when we're coming up into the doses that are a little bit higher. And dividing up the dose at times might help to tolerate these medications better. So if the doctor says to take it twice a day, then we would be taking it in the morning before breakfast and in the evening before supper. So what are some of the side effects of these medicines? First of all, only about 2% of those people who take these medications have to stop treatment because of very severe side effects. In general, they are very well tolerated. One of the more serious problems, though, is that they can cause severe cases of low blood sugar episodes. And this is because they are such potent medications. Low blood sugar is also called hypoglycemia. And low blood sugar usually causes one to be dizzy, to perspire, and to feel overall very poorly. Some people also report that they get palpitations, they say they get a change in heartbeat and so forth. Now, if not recognized and treated, a hypoglycemic episode can land one easily in the hospital. Prolonged severe hypoglycemia can cause very serious damage. So it is very important that we follow instructions extremely carefully when we are taking these medications. Now, any medication, of course, can cause nausea and vomiting and an upset stomach and so forth. Usually it's not a problem, but dividing up the dose might be sufficient in order to help with this situation. However, the one who makes that decision is your doctor, not the patient. And as always, take your medicines with enough water. However, a severely upset stomach for a diabetic patient can cause trouble because it can interfere and disrupt the patient's eating and snacking schedule, and that is very important in diabetes. We have to keep a decent eating and snacking schedule. So if you have a very severely upset stomach, then please call your doctor and inform him or her of the situation. Drinking alcohol with some of these medicines can also make a person quite sick. The patient will feel flushed and tingling all over, and sometimes we might also experience nausea and headaches. And this is called the disulfiram reaction, and it happens particularly when we are drinking alcohol together with Diabanese or chlorpropamide. And remember, that was the medication that was in the first generation, and it was the longest acting one. Now, the disulfiram reaction also happens to some people on tolbutamide or Orinase, but it does not seem to be a very great problem with the 2 agents that we are using now almost exclusively, namely the 2 agents on the second generation, glyburide and glipizide. However, the potential for such a reaction always exists because there are simply no guarantees. We are all different in how we react to medication. Now, I would advise any diabetic patient to ask his or her doctor about the use of alcohol in diabetes. Having diabetes does not mean that you will never have a glass of wine again or a glass of beer again. But alcohol does affect blood sugars. I don't know exactly what the dietitians have to say about the calories, but an honest understanding of the situation is definitely most important. Notify your doctor if you come down with things such as a sore throat, when otherwise you do not seem to have a cold or you do not feel sick. Also notify your doctor if you have any signs of jaundice, such as if your urine turns a dark orange color or if the white of the eyeballs starts getting a yellow hue, because those are signs that there might be something wrong with the liver. Because these medications are extensively broken down in the liver and in certain cases can cause liver damage. And people who have liver damage have to be extremely closely watched when they are on these medicines and sometimes do not qualify as candidates for being treated with these medications. And then of course we have the allergic reactions: itching, hives and rashes. Incidentally, if you are allergic to sulfa, then you might not qualify for treatment with these medications. Discuss your sulfa allergic reactions with your physician, because sulfonylureas and sulfa can cross-react. So if you had a bad reaction while on sulfa, the same thing can happen to you when you're taking these medicines. Sulfonylureas also sensitize the skin so that we burn more easily when exposed to sunlight or other sources of ultraviolet light. So careful with the tanning booth and with the roasting sessions on the beach. And now for some things that we should never do while we are taking these medicines. First of all, never take more than your prescribed dose. The physician adjusts the dose, not the patient. And some people have a tendency to try to take a little bit more than what was prescribed because they are afraid that they might be switched to insulin in case that the medication fails. And indeed, there are some failures with these medicines. Around 5 to 10% of patients who have initial good response with these medications ultimately can fail within the first few months of treatment. And after about 10 years of continuous treatment, failure is close to 50%. And those are the people who responded favorably in the beginning. Now, diabetic conditions of course change. And as we get older, nobody gets any younger, of course, and also maybe physically better off. And so we have to expect that the condition changes. The time comes maybe when the pancreas becomes increasingly sluggish and fails to cooperate. Also, whenever we experience some failure or the blood sugars don't seem controlled anymore, we have to ask whether we wandered off our diet and exercise program or what we have been doing differently that might be throwing our sugars off. Now, some research also has shown that there is definitely a limit as to how high the daily doses for these medicines can be. Because taking more is not necessarily better, and above a certain limit there does not seem to be any increase in the benefit to the patient. We simply saturate the system and all we get is an increased risk for side effects. Now, there are some new techniques out there that are being experimented with, and it seems to be true that adding a little insulin to the treatment protocol of patients who seem to be failing or becoming resistant to their sulfonylureas, that might just help. But oftentimes the doctor just wants to switch totally over to insulin. So discuss your choices with your doctor. Never stop taking these medications without talking to your doctor first. Most people tolerate these agents well, but if you do not, then an alternative has to be found. Diabetes cannot be ignored and it needs treatment. And research has shown that the tighter the blood sugar controls, the better off the diabetic patient is. And I'm showing you here an article that appeared in the US News and World Report, June 28, 1993. And again, it deals with warding off problems in the long run by keeping tight control on blood sugars. So this is no longer a secret, it's no longer just reported for the professionals, it is also appearing in the lay press. Now, people often wonder if there is a way to predict who will be a good responder and who won't be when it comes to these oral hypoglycemics or sulfonylureas. And the statistics show the following. First of all, patients older than 40 years of age usually respond better. Patients with reliable meal and snack and exercise plans. Patients whose weight is within 110 to 160% of their ideal body weight, and of course the closer to the ideal weight we are, the better off we are. Patients with fasting blood glucose levels less than 200 milligrams per deciliter, and then also patients who have never required insulin or who were regulated in the past on less than 40 units per day. And remember, only patients diagnosed with type 2 diabetes qualify for these agents in the first place. So if you fit into the category that we just described, then your chances of being a good responder run around 80 to 85%. But oftentimes it is said that if a patient fails to respond to one type of hypoglycemic agent, then sometimes there might be benefit in switching to another one and trying once more. But if we fail on two, then oftentimes switching to insulin might be the alternative. Good control of blood sugars, as I said, are very important for the successful treatment of diabetes. So please keep an accurate diary of what your blood sugar tests are. And write a possible explanation in your diary of why you might be running high or low on your blood sugars. For instance, did you wander off your diet? Were you in a stressful situation that particular day? Did you have an infection, a cold, or a flu? Did you take any over-the-counter medications that you might not be used to and that might have affected your blood sugar? See, the better the data and the more complete the data and the information is that you can supply to your physician, the better the decision is that your physician can make on your behalf. And now let's talk a little bit about over-the-counter medications and diabetes. Now, patients with diabetes have to be particularly good label readers when it comes to picking out some over-the-counter medications in case of cold or flu or a headache or whatnot. And I show you here this article that appears in the US Pharmacist, which is one of our professional magazines, and this was in January of 1993, and it correctly states that patients who are taking over-the-counter medicines and who have diabetes should make sure that they are monitoring their blood glucose levels. Now, over-the-counter products should be sugar-free and preferably alcohol-free. So that means we have to read the labels. And this comes down to when we have to pick out or cough syrups, throat lozenges, any of those things. So either read the label. If you have problems with it, please ask your pharmacist to assist you, because it's important that you're picking out a decent product for yourself. Now, bulk laxatives can contain plenty of sugar. So look for the sugar-free statement on the label. Things as easy as aspirin can affect blood sugars, but usually the occasional use of aspirin, such as during a headache or something like that, does not do much damage. It's when we are having higher doses and prolonged use of aspirin that should really be done under a doctor's supervision, and you should really monitor your blood sugars closely. And then we are coming to the decongestants. Now, here in Minnesota, of course, we have plenty of flus, plenty of allergies and colds and so forth. And so over-the-counter decongestant medications are all-time favorites. They are the ones that are supposed to make you breathe easier. When your nose is all plugged up and so forth and you take a decongestant, that should be helping the situation. But again, prolonged use can increase blood sugar. So now, over-the-counter diet pills are also full of high-dose decongestant medications. The higher the dose, the more the decongestant medications are affecting the appetite. And these are now two reasons why diabetic patients should not be taking those over-the-counter diet pills, because they can make the blood sugar rise, and also if you have to lose weight and you're a diabetic, you have to do it the old-fashioned way, by means of diet and exercise. Now, the names for decongestants that we're looking for are like PSEUDOEPHEDRINE and phenylpropanolamine. They are the ones that we are running across the most frequently. So let's read a label here and let's see how two cold medications, for instance, would compare for a diabetic patient. Now, here I got a sample that was sent into my house of Tylenol cold and flu. Okay, I read here, it is flavored with aspartame, so that means it is sweetened, I should say, with aspartame. That means it's sugar-free, so that's good. But it does contain pseudoephedrine, that's a decongestant, so I have to be cautious. Then I have Robitussin CF. I had a bottle here in my house. It's also a nasal decongestant. It's one of those medications that's used quite a bit, as a matter of fact, when people have colds and flus. Now here we have, it's a syrup, so it contains sugar. It also contains some 5% of alcohol, which actually is not all that much if you figure that some of those over-the-counter medications do contain up to 20% of alcohol at times. That's more serious. Then we also have in this medication phenylpropanolamine. Phenylpropanolamine is again a decongestant. So the diabetic patient has to really read the labels. And if you do read the side panel here on the Robitussin bottle, and then also on the Tylenol cold and flu, it does say in the fine print that unless you're directed by your physician and you're a diabetic, you should be using this product with caution and you should be checking with your physician. So read the fine print, read the label, and please ask your pharmacist for assistance. When you have a severely plugged up nose, as is often the case here in Minnesota, then maybe a nasal spray, a decongestant nasal spray, might be of more help for occasional use, such as before bedtime, so that you can sleep a little bit better or whatnot. But please do not use any more than what is indicated on the label. If it says use every 12 hours, that means it's a prolonged kind of an effect medication. Then use it only every 12 hours. Otherwise, you're running the risk of getting into what we call rebound situations. And that means your membranes in your nose are going to become so irritated and they are becoming so dry that all of a sudden you have like almost what we call the terminally plugged up nose, and it takes quite some working to get that situation remedied. So only use as much as is indicated on the label, and maybe that would be a better idea than taking all sorts of decongestants orally that might be affecting our blood sugar. When you have a very severe cold or a very severe flu, then please check with your physician. Don't self-medicate yourself too long. And now we are moving right along to our medicinal herb for the evening, and this is tonight Echinacea purpurea, or also called the little purple coneflower. Actually, there are 3 members in the Echinaceae family that have been used as medicinal herbs, but the little purple coneflower seems to be still the most popular one. Now, these plants have always been very much used in Europe for their healing abilities. And among the Native Americans, they were possibly among the most used medicinal herbs. They were relied upon to treat wound infections, burns, and even snake bites. And in folk medicine, the blood purification and natural antibiotic properties of the Echinaceae have long been recognized. But with the coming of penicillin and other antibiotics, the Echinacea family kind of fell into disuse. But they were never totally forgotten. And nowadays, alternative medicine and alternative healing methods coming again upon us, all of a sudden, guess who's back with a vengeance? The Echinacea, particularly the purple little coneflower. Now, in September of 1992, the issue of Health magazine had a very good article on this subject, and it was put together by Clark Morton. He interviewed various herbal specialists, and it turns out that indeed the Echinaceae are used mostly nowadays for their immune system boosting properties. Taken at the first sign of a cold or a flu, they have made plenty of grateful believers who sing the praise of the Echinaceae for protecting them from the miserable effects of the body-invading viruses. The Echinaceae seem to prevent viral infections such as cold and flus by building up the immunity of the victim, and thus they are different from over-the-counter medications that we just talked about, actually, because those over-the-counter medications merely mask the symptoms of colds and flus. They really do not treat the cause. Echinaceae seem to be treating the cause. Now, in Europe, however, it has been found that taking these products continuously actually makes the body less responsive to their effects. The decrease in response seems to appear after about 8 weeks of continuous use. Breaks in the treatment help to maintain effectiveness. Now, Andrew Weil of the University of Arizona College of Medicine recommends that a treatment cycle of 2 weeks on and 1 week off be used. Now, here in the US, it is difficult to obtain reliable hard data on any medicinal herb in general, mostly because of our contorted drug regulation rules. And so we rely in essence on reports from abroad in order to find out whether an herb is effective, not effective, or might even be dangerous. For the Echinacea, most of our information comes from Germany, where the herb is commonly prescribed by physicians. Now, Varro Tyler is a professor at Purdue University and one of the country's leading experts on herbal medicines. And he feels that the products that are most effective and have the most predictable and reliable strength across the board are the tinctures or the extracts. And he also agrees that breaks should be made during the treatment. Classically, drops of these tinctures or extracts are put into warm water or tea and then drunk. Anywhere from 20 to 50 drops depending on the product being used. So check the label instructions for your manufacturer's recommendations. Now we drink these 2, 3, sometimes up to 5 times a day. Again, it depends on the product. Now, although the Echinacea seem to have an immune system booster effect, so far there does not seem to be any reliable evidence that they will help people with severely run down or weakened immune systems, such as people with cancer or with AIDS. But then again, who keeps statistics? Also, Echinacea should not be given to kids under 2 years of age. And as a matter of fact, your tinctures and extracts are high in alcohol and they do not qualify as pediatric medication. You should always check with your pediatrician before you medicate your children. So again, the Echinacea might be another tool in the department of preventive medicine. If we are overall healthy, they might just give us the extra boost to help us over the rounds with colds and flus so that we can maintain that much sought after clear head, nose and throat. And this brings us one more time to the end of our show. I thank you so very much for watching. I look forward to seeing you again next time, but until that time, stay safe, stay healthy and good night.